Time to round up a big topic from the week. The Harris County Sheriff is mad at the state agency that runs the state's mental health hospitals. He says about a third of inmates wouldn't be committing crimes if they were given the proper treatment. Instead, they're winding up in jail and putting a health and financial burden on the county. The state agency is being reviewed by an advisory commission, which will hold hearings later this month on a report from staff calling the system a mess. So who bears responsibility for this problem? That's our topic this half hour. We want to hear from you on our Fox 26 Facebook page. You can also tweet using the hashtag Fox26forlife. Joining us live in the newsroom again is our legal analyst, Chris Tritico, our news analyst, Mustafa Tamiz, and public policy analyst, Jackie Bally. All right, guys, the sheriff says a third of the 9,000 people in custody are on medication. A third of the people who he says should not be there in the jail. So what kind of action do you think is required here?
Well, look, this whole system is crazy. We've been dealing with this, and I've been railing on this for over 20 years on the fact that the state of Texas does not take care of its mentally ill population. We haven't for years. They don't have a lobby, and because they don't have a lobby, they're dropped to last every time. And that's what created this situation. So if you want to do something about it, the legislature needs to step up, fund mental health care, take the dollars from the federal government, pump that money into mental health services, and then we can start seeing a breakthrough. You know, when a family takes their loved one who's having a mental health issue, a mental health crisis, to MHMRA, they give them 3 days. And 3 days is not enough time to take care of anyone in a mental health issue. It just pumps them up with drugs and puts them back on the street. And Jackie Valley, that's why they end up in jail.
Well, this is a problem that we've had for many years, like you said. And the statement that Adrian made is pretty broad, pretty sweeping. But I do agree with some of the comments you made. I do think that we need to first tackle the legislature and the policies that we have and that we're making. I was speaking to some in the mental health industry, and they're saying we need to not only educate our legislators, but also educate the public. It's a three-step process, and a lot of us aren't taking the three-step process seriously, and that's why we're in the position that we're in right now. Now, for the sheriff to say that the State Department is not doing its job, that's like saying, well, if we have crime on the streets, he's not doing his job. Because first we have to look at the law in the books and make sure that we make some substantive changes. Hopefully, we're going to see that coming up in the next session, because you're seeing a lot of different legislators. They are now reaching out to our mental health professionals to try to tackle this problem.
What Adrian Garcia is saying is they wouldn't be in jail at all if they had proper mental health services to begin with. Then we get them in jail, and I don't have the ability to treat them.
Well, Adrian is very smart. I mean, since he's been in office, he's brought this whole department under budget. He's saved a lot of money in health services within the sheriff's office. And this is a big issue, not just for Harris County, but across the state. Because what's happening is, because we don't treat mental health patients properly, because we don't put them in hospital beds, they end up in jails, which costs us all a lot more money.
A lot more money than what we could have done had we treated that in the beginning.
Absolutely.
I'm going to go to Sally. She's monitoring our social media.
Yeah, Pedro had tweeted us that this was a delicate issue requiring attention, of course, and then Sheriff Adrian Garcia responded back saying, yes, it is, and it does need lots of attention. And then the it factor says these shooters, he's referring to some of the latest mass shootings, and more than half of all prison and state inmates are mentally ill. Mental health is one of the major issues of our time.
Well, he's right. It's unfortunately, it is the neglected issue of our time. And like I said earlier, it's because they don't have a lobby. They don't have anybody fighting for them at the legislature to get dollars to help them.
But we've also talked about the lack of money that's in the legislature statewide, nationally, that the lack of dollars that are there already. So we have all of these policy areas, and everyone wants a piece of the pie. So for the mental health industry, again, I do think public education, public outreach first, that will have to be done, because a lot of the legislators, even the general public, they're not aware of the staggering numbers sitting in Adrian Garcia's cells. They don't really pay attention to a lot of this until there's a mass shooting or there's something of that nature.
But isn't a lot of it
and we've talked about it several times on the show.
We have talked about it. Isn't a lot of it a misconception by the public that the mental health is what got them into trouble,
That's exactly my point.
not criminality in general?
That's exactly my point. I think it's education of our public and our legislators.
Look, this is consistent in how we handle government. We spend more money, on the back end rather than spending on the front end. We spend more money jailing people rather than giving them the mental health resources they need in order to stay out of jails. We spend more money, in emergency rooms rather than providing health care. So whether it's not expanding Medicaid, which is what the governor didn't do, or putting more money in mental health
And
and managing the
we're almost out of
agency.
time, but I'll bring that up. Texas ranks at the bottom of the nation in mental health care coverage, and yet we keep turning down federal dollars that we could pump into this system.
This is bad government by Governor Rick Perry and the Republican establishment.
Final thought.
We're not going to sit there and say that a broad sweeping area that is the person in charge right now. I will say this: prevention, intervention, and recovery. And the Republicans are the ones who are saying we're going to start tackling this.
We can make broad statements of President Obama when it comes to the VA, but if it's Governor Kerry's agency, it's broad statements.
All right, we're going to have to leave it right there, Sally. We'll be back in a few minutes.
I saw that look Jackie just gave him. Okay. All right, we'll see you then. Thanks, guys.